Welcome to Lakeshore Focus, a weekly show highlighting key issues, interesting people, and significant events in our region. I'm Keith Kirkpatrick. Most wars are fought without people really understanding why. The struggle for healthcare reform in this country is just the same. I've never witnessed so many strong opinions based on so little information. With us today to help us understand the issues is Dr. Samuel Flint, who is the Associate Director for the School of Public and Environmental Affairs at Indiana University Northwest. So, Sam, I hear you're an expert on this. Is this true?
Well, I've been working at it for the last 35 years, so I've picked up something along the way, hopefully.
Well, good. So you're the right guy to help us. I'm really hoping on this show that we can try to not dumb this down, but really try to understand it, because I think we've got so many people who really don't truly get. Why is that? Why are people so confused over what's going on?
It's a confusing issue. It's complex. We have a public-private mix of financing of healthcare. It's just a very complicated system with that's a patchwork. And it's hard to understand. If people are confused, it's understandable why they are.
And really, the whole passing of the Health Care Act a few years ago was a continuation of a whole bunch of reform that we've been trying to do for a long time in this country, correct?
It's for 100 years, literally 100 years. Teddy Roosevelt, when he ran for president in the Bull Moose Party, wanted national health insurance. Franklin Roosevelt in 1935, when he put together the New Deal, had national health insurance and then dropped it because of fear of political fallout. Harry Truman tried it. Bill Clinton tried it again. And what's happened instead is we've got small pieces: Medicare, Medicaid, the Children's Health Insurance Program, insurance reform, other things like that. So there has been a lot of health legislation passed, but we have never really bitten the bullet, so to speak, and said everybody gets a Medicare card, or everyone is covered. So the holy grail of universal coverage, even with this bill, we still will not have reached it.
So we finally got, evidently, the critical mass a few years ago to pass this. We finally got to the point where people said enough people said we've got to make a significant change. And this has been a big change, right?
This is a major change to the system, yes.
Okay. But you know, what's interesting before, I think if you ask the average American citizen, what do they think of healthcare in America, there's kind of an interesting dichotomy to it. They will say we have probably the best healthcare system in the world. On the other hand, they'll say we are spending way too much and cost is out of control. Is that true?
It sounds contradictory, but both of those are true. We have the best healthcare system in terms of the most advanced body repair techniques, okay? If you think of the healthcare system in broader terms of population, we don't do that well. We're low in terms of infant mortality, longevity, treatment of amenable diseases. We're actually ranked last out of the 19 industrialized countries in terms of having the healthcare system effectively treat people with illnesses. And the reason for that is 50 million people are out of the system. They're uninsured.
Well, let's talk about that. And I kind of brought some marbles here along, or colored stones, I guess, white stones, to maybe see if we could represent this. And I think you and I talked about maybe each of these stones represent 5% of the American population, and we'll look at the whole country. How many people in this country, or what percentage, are covered by health care, medical care?
All right. All right, let's start out with, we have an employer-based system. So you really would have about 48%, 9 of these approximately, people that are covered either by their employer or they're a dependent with employer coverage.
Close to half, then.
Close to half. But that number keeps shrinking, and the employer mandate's going to change that. You've got another 5% that have private health insurance that buy in the individual and small group market. Those are the folks that are paying outrageous premiums, because insurance companies have difficulty estimating the risk.
Does a small business owner, is he or she in that group, or are they part of the employer?
They would be considered part of the employer. This would be the individual person, self-employed. Okay,
right.
So that's the private side. So about
Okay.
50%. Then you've got the public side. About 15% of the population in the state and nationally is on Medicaid. Medicaid is the program that passed with Medicare in 1965 that covers low-income people, low-income families.
Okay.
Then you've got another 15%, which would be covered under Medicare. Medicare is for people over age 65 or people who become disabled. So that's another population.
And that's a growing group, right?
Both groups are growing.
Both of these groups.
Both of those groups
Okay.
are growing, and the Medicaid group is going to, it was designed to grow considerably under Obamacare, but it hasn't worked out that way.
Is that group growing because our poverty population is getting larger, lower income?
Because income stagnation is part of it. States liberalizing Medicaid eligibility to allow optional groups, optional populations
More people
into
can
the
get
program.
into it. Okay.
Yeah.
So who's left?
So who's left? Let's see. You've got 2, 4, 6, 8, 9, 45, 50.
We got 20% left.
15%. Yeah, this is probably closer to it. 50% employer, 5% individual private
Okay.
insurance, 15% Medicaid, 15% Medicare, public coverage, and 15% no insurance at all.
Okay, this is our no insurance group. And it's easy to look at stones here, but we talked about this earlier. Given the population of this country is 300 million, each one of these is representing about 15 million people. So this is 45 million people in this country.
It's closer to 50. We're rounding off. So
Okay,
it's
who don't have insurance at all.
Yeah.
I mean, so what do those people do right now? These people, what do they do if they need health care?
Well, they pay for it themselves. They do without. They go to the emergency room of hospitals, and since 1986, under the EMTALA law, basically all hospitals must treat anyone who presents to them in an emergency condition. So
that's why this group oftentimes will go to the emergency room, not go to a doctor, not do anything except go to the emergency room because they will get treated.
They know they'll get care,
even if it's a if it's a bad cold.
Well, yeah, but that's kind of a myth. The idea, people don't want to wait 2 hours in an emergency room for low-grade fever. They've studied the Medicaid population, which also goes to emergency rooms frequently, because a lot of doctors won't take the very low pay, that reimbursement that Medicaid offers. But these folks, when they go to the emergency room, the ones paying for that are these people over here, because the money is the so-called cost shift. So what happens is hospitals they can't change the Medicare payment, that's fixed by law. They can't change the Medicaid payment, but what they can do is charge more to people covered under private insurance to pick up the tab for people who are uninsured. In 2005, that was about, in Indiana, it was about $1,000 a family. Now it's running about $1,500 a family, and it continues to go up. If these folks get covered at that point, the cost shift is reduced for these people here.
Why again do people not understand some of this? Because it only seems logical if you've got this large a group who can't afford medical care, and when they get treated at a hospital or someplace, someone absorbs that cost. Why can't they see that it's the paying customers that are absorbing that cost?
Because it's hidden. It's cross-subsidized. Because your employer says, here's your health plan for the year. Oh, by the way, your premium is up X number of dollars, and we're also going to charge a $25 copay for prescription drugs that you could get generic and choose not to. People get wound up in all the details of that. The notion of a cost shift in how hospitals finance, their care to stay solvent, it's very complicated.
Now let's go back.
The point is, these are hidden. It's a hidden tax.
Right.
That's really how you have to think of it. Every Indiana family that has private insurance coverage has a hidden tax of $1,500 to pay for the uninsured.
Or it's a hidden cost. Right.
It's a hidden, right?
Because it's built into the cost of
it's
the
built
care.
into the cost, but it's the if everyone had coverage, that $1,500 cost shift would be eliminated.
Now the new law, the federal law that goes into effect, everybody seems to think it's changing dramatically this landscape. Is it really?
Well, some of the changes have already occurred. Okay. For instance, people, young adults under up to the age of 26 through the age of 25 now can be covered on their parents' health insurance. The people on medic, so that
shifted a few of these these uninsured over into the employer
That's
side.
correct.
Okay.
That's correct. That's reduced.
This is where we'd have to start slicing these down into slivers.
The Medicare population, they've already received some benefits from the law that was passed. The so-called donut hole prescription drug coverage was better. Preventive care services are better. So a lot of things have changed. Matter of fact, the people here. 105 million people had limits on their health insurance coverage. So if they reach $1 million in expenditures or $2 million, it doesn't matter that they've paid their premiums, the coverage is capped. That cap has been taken off. So there have been benefits to different parts of the population from Obamacare already. The big change that's going to come starting January 1 is the availability for these folks and these folks, the individually insured and the uninsured, to buy health insurance through a health insurance exchange.
Okay, so there's a lot of talk about employers, small businesses, being forced into this. Is that changing? That some of these people are going to be able to get insurance because it's moving? Is that again a huge group?
It's the Obamacare plan basically was targeting 2/3 of the uninsured. So it was about 16 million uninsured would be covered under employer plans, and about 16 million would have been covered by Medicaid if all states had opted for Medicaid. Okay. So there's that issue. The other thing here is when you look at the employer coverage, 93% of employers with 50 employees or more already provide health insurance. And if you have less than 50 employees, there is no employer mandate. So it's only for mid-size and mid-size and larger businesses. Like I say, 93% are doing it. The other 7% are going to have to provide coverage that meets certain requirements, or starting in 2015, pay a fine of $2,000 per employee. That money goes in so these folks can buy coverage in the health insurance exchange, and that's how some of the funding for the health insurance exchange is created.
So really, again, we're talking about from this uninsured group. The plan was to try to shift one of these groups over into the small business piece to come over to this side, and then actually allow these people and this group to now participate in a pool.
And there's one more piece. 5 of these people are supposed to go into Medicaid. That was the other piece.
So Medicaid would be expanded.
Medicaid was to expand by about 16 million, but the state of Indiana is not opting for the full Medicaid expansion.
Okay, I want to come back to that in just a minute.
Okay.
So with this, theoretically, we would have ended up with having this 30 million people either still in the uninsured, or they would be in a pool, and so we would probably see some of those people still able to buy, and we're hoping that some part of this would be able to move over here.
Yeah.
We'd still be left with...
We still would be left with
10 million or something.
15 million people, 5% uninsured. We would drop from 15% of the population uninsured to about 5%, with 5% going to under employer coverage or through the health insurance exchange, and 5% going on to Medicaid. Medicare, except for a few benefit changes, is neutral.
Then why are there so many Americans who are just either I put them in the category of scared or just so angry about this.
They've been scared by a misinformation campaign for those folks that want the status quo, profit from the status quo, and don't want the change.
And I've seen, I mean, that's everything from the people who can make this death squads, and I mean, just we've heard everything,
death
right?
panels, yes. The IRS was hiring 15,000 armed agents. Not true. As a matter of fact, no one can go to jail if they don't pay the individual mandate fine, which, by the way, is $95 the first year. So there really has been much ado about very little. Most people who are covered in private insurance with their employer, they're not going to notice any change at all. They'll get a few things. They'll get the catastrophic cap eliminated. They'll have preventive care covered with no caution. So they'll get a few benefits, but their world's not going to change much. The Medicare population, their world's not going to change much. The people on Medicaid's not going to change much, except we're going to have more folks join them.
So is cost though going, cost seems to be going up on the employer side. And is that really about the healthcare reform and what's going on, or is that just healthcare cost in general continues to climb?
It's really the latter, but there's actually been good news in the last couple of years. The cost increases have moderated for health insurance, for employer insurance, and there was a study that just came out by the Kaiser Foundation. 18 states have the premiums that they're charging for the health insurance exchange, and there's as Paul Krugman said, there is a bit of a sticker shock, except it's on the other side. Prices are lower, so they haven't been reduced, but they are lower than what people expected. The whole idea with cost containment was not to bring costs down. Aging population, technology, you're not going to bring the cost of healthcare down, but if you can so-called bend the cost curve, flatten out the increases, so the rate of the growth of cost of the rate of increase for the cost of healthcare expands as the same size of the economy. That's victory. So we don't get a percent of GDP continually increasing.
But you're starting to sound like a physician that you're telling me, I know there's pain and a lot of pain, but it's not going to be as bad as it used to be.
What we're saying is that you have an illness, and I'm going to give you a pill, and that pain and we're going to moderate some of that pain. Okay. So your condition will be improved. Now, obviously, some people have to pay for this, and there are taxes. There's a 3.8% tax on unearned income for people who earn over $250,000 a year. So there are some taxes. Employers pay taxes if they don't provide it. So, yeah, there are some winners and losers, but the extent of the so-called government takeover of the healthcare industry, that's nonsense. Not gonna
happen. Well, do you think there's hope that we can get to a point where our decision makers in government can see that we're moving this direction, that we can change, but can continue to negotiate these changes and navigate through this?
Oh, absolutely. I mean, one of the pieces in the bill,
if cool heads prevail.
If cool heads prevail, and we'll just let that just lie there. But one of the elements in the plan is called the medical loss ratio. And what it says is that depending on the size of the group, every insurance company has to spend 80 to 85% of each premium dollar on healthcare services or quality improvement. There's been $2 billion worth of rebate checks that have gone out. So there is more of a public utility aspect to the healthcare system. So and that's what it's moving toward.
But this sounds like a lot of government intervention when people today are saying the government's too involved and they're intervening too much in all of this.
I didn't see anybody turn the check back that they received August 1st. So government intervention when it's giving you more money, all of a sudden is a little less difficult than when they're taking money.
Same kind of thing when we've heard people being very critical of this, but they're pretty happy that their 24-year-old is insured at this point.
That's right.
And that wouldn't have happened before. So we're down the last minute or something here. Where's this all going down the future?
Well, the biggest issue right now is there are two issues. One is the implementation of the exchanges and getting the uninsured to in small groups to be able to purchase care at a reasonable rate. The other piece is the Medicaid expansion. Half of the states have said that they don't want the Medicaid expansion. Indiana's kind of in between. We have this Healthy Indiana program where only 5% of people are covered. It covers 45,000 out of 800,000 uninsured. But right now the state has not said that they would take the expansion. That can be changed. Medicaid expansion, 93% of all the costs for the new people on Medicaid for the first 10 years of the program is covered by the federal government, compared to 67%. So it's a very generous offer. It's for ideological reasons and partisan reasons. The state of Indiana, like other states, are rejecting it.
We'll have to get you back to probably finish this out. And you have proven to me that you are an expert, and I hope our audience has a better understanding of this. So thanks for coming and helping us understand this all.
Thanks very much for the opportunity.
Some of the greatest writing of all time can be viewed in the founding documents of this country. It is amazing prose filled with inspiring concepts. The text in the second section of the Declaration of Independence reads, "We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness." That sentence was fundamental for the justification by our American leaders to rid the colonies of England's rule. Since then, we have struggled to make our declaration a reality for everyone living in this country. First, look at the phrase, "We hold these truths to be self-evident," meaning it's an obvious set of facts. Now, I know these days in our country, one could question what a fact is. The definition of the word is something that can be shown to be true, to exist, or to have happened. Now, let's review the last part of the text where we are told that we have unalienable rights, and they are life, liberty, and the pursuit of happiness. Unalienable means something not to be given away or taken from us. So we should each have life and liberty. It's interesting that happiness must be pursued, not just exist for each of us. I want to take those three ideas and apply them to today's topic of healthcare. First, the facts, meaning what can be shown to exist or have happened. We know that when our bodies, minds, or spirits do not functionally properly, we have a difficult time conducting the daily affairs of our lives. It's also evident that the greater the complexity or intensity of our illnesses, the greater the complexity and intensity of our problems. Finally, if you get sick, you may die. It seems to me that it's pretty hard to pursue happiness or have freedom to do what you need and want when your health is bad. And if you die, you are deprived of life. Doesn't it then follow that all of us should have access to health care? It seems simple. The only question that remains is this: if it's all so self-evident, then why does it take so long to explain it? No wonder the debate over health care rages on. I'd like to hear your ideas and opinions on the topic of healthcare in America. Did our show help you understand the issues better? Did it make you think about your opinion on the issue? You can email us at focus@lakeshorepublicmedia.org or reach us through our website, which is on your screen. Join us next week for another Lakeshore Focus. I'm Keith Kirkpatrick saying make a positive difference in our world today.